So a tummy tuck or an abdominoplasty is a cosmetic surgery to improve the shape and contour of the abdomen. It's an outpatient surgery. It can take anywhere from, I would say, 2 to 3 hours, and it can have a dramatically positive effect on a patient's abdominal wall in terms of its integrity and strength, as well as its appearance. As far as who's a good candidate for a tummy tuck, really it's any person that's had a significant change over time to their belly, where the abdominal skin stretched out, and that can be a result of things like pregnancy or significant weight changes. So really any woman who's had a pregnancy has had a rapidly expanding uterus. As the baby was growing, the uterus expanded, and then the skin envelope stretched to accommodate the growing baby. As the baby gets delivered, the uterus starts to contract. The skin envelope contracts somewhat, but sometimes it doesn't have as much spring as it used to, and a patient, a woman, is left with loose skin, loose redundant skin. The same thing can happen not just with pregnancy, but with significant weight changes. So if you gain a ton of weight and then lose a ton of weight, whether that's with diet and exercise or with intervention, like a surgical intervention or a massive weight loss procedure, again, that rapid change can cause the skin to become stretchier, looser, redundant, can cause folds, can cause irritation. These are the kinds of patients that I think are great candidates for a tummy tuck operation. It can really improve quality of life. So yes, you can combine other procedures with a tummy tuck. We have something called a mommy makeover, and what that is an operation to get the breasts lifted and firmed up and brought higher and tighter after, again, the changes of life, weight changes, pregnancy, and we can do that at the same time as a tummy tuck. So that would be a breast lift and tummy tuck or a mommy makeover. We can also do an arm lift or a brachioplasty. Again, after weight changes, significant weight loss, you get loose, drooping skin in the arms. We can do that arm tuck at the same time as doing a tummy tuck. The rule of thumb for me is to try to keep the surgery within about 5 hours. So that can be safely done in our outpatient surgical center. And so, yes, certain procedures can be combined with the tummy tuck. So in plastic surgery, there's no such thing as scarless surgery, but what we do try to do is hide scars and make the scars look as aesthetic as possible. So in a tummy tuck operation, it's not that we're doing the surgery in a scarless fashion. There is a scar, but we try to hide that scar. We try to keep that scar as low as possible. The scar typically extends from hip to hip, but we try to keep it in the underwear or bikini line, such that when you're wearing a bathing suit, no one can tell that you had the operation. There's also a scar around the belly button itself, but again, that scar can hide in the belly button and blend over time, such that, again, it's hard to tell that you had a surgery. So recovery after an abdominoplasty or a tummy tuck, I think, is about 3 weeks. The most difficult part of the recovery are the surgical drains. We do use drains when we do the procedure. These are small plastic tubes that exit out the skin through separate tiny incisions, and those tubes evacuate fluid that can accumulate under the abdominal skin. We want that fluid out so that everything can heal nicely in a tucked in, compressed fashion. And so you have to manage drains for 1 to 2 weeks. And then I would say another week or so to be feeling back to normal. So 3 weeks total, I would suggest to set aside for recovery after a tummy tuck. If you have a sedentary type job, you could probably be back to work in 2 weeks. But if you're up on your feet a lot for your work, I would say set aside 3 weeks for the operation. So with regard to the question about having more children after a tummy tuck, we don't recommend it. We would recommend that you finish having all of your kids so that your body has gone through that process of expanding out the uterus, contracting, expanding out the uterus, contracting. And then once you've reached a stable equilibrium point, done having children, then have the tummy tuck. If you go ahead and have that surgery and then get pregnant again, now that we've had everything reset, you're stretching that reset skin envelope and potentially getting things looser again. So we don't recommend that. If you're thinking of having more children, have your kids and then have your tummy tuck once you're completed building up your family. So thanks for listening today to me talk about one of my favorite operations, the abdominoplasty or tummy tuck. Again, it's a wonderful operation. It can be combined with other procedures, especially liposuction. So it's something that we do a lot of here at Salem Plastic Surgery, something that we do very well. And if you're interested in learning more, please reach out, call us at our phone number, which should be listed somewhere here, and ask for a consultation with one of our board certified plastic surgeons. Thanks.